Hello, everybody. Thank you for joining the LNR USA sponsored webinar. Today with us, we have Betty Westbrook, and she's going to talk about how to help your patients sleep their way to better lymphedema management. If you have any questions, feel free to just type it in the Q&A section, and we'll definitely make sure to touch on those at the end. So at this point, I'm going to hand it over to Betty. Betty, thank you so much for being here today. We're really happy to have you.
Hi, Lindsay. Thank you. I appreciate it. All right, everybody. My name is Betty Westbrook. I am really excited to be here today. I will be presenting, like Lindsay said, on how to help your patients sleep their way to better lymphedema management. I am a certified lymphedema therapist. I'm also a physical therapist assistant. And I have a passion for teaching and helping others learn more about lymphedema. So I started the Lymphedema podcast, and 2019 is when I started the podcast. And it has really grown and been a really good tool and a resource for those patients, caregivers, therapists, anyone really who is looking to find more information on lymphedema. So if that's you, we're going to give you some information at the end of this presentation. But it's Lymphedema Podcast. It's that on all social media, Facebook and Instagram. And you can also find it on pretty much every podcast streaming app, Apple Podcasts, Google Play, things like that, Spotify. In addition to all of that, I saw the need for kids who have lymphedema. So I am also the founder and director of the only summer camp in the United States for children with lymphedema. That's Camp Watch Me. And I'm so excited because June 16th through the 24th, we will be in Colorado with 20 different families from all over the United States and even a few international families coming to learn more and to help their children be educated and aware of how they can build a better life with lymphedema. And honestly, LNR plays a huge role in that. So without further ado, we're going to jump into this presentation because nighttime management is kind of a piece of the puzzle that people tend to leave out. And there's a couple of reasons why, but first let's talk about why it's encouraged to have nighttime compression and not to forget about it. So it is recommended in, your certification courses that patients are in compression 23 hours out of the day when they have an impaired lymphatic system. And we know that is because the body creates 3 to 5 liters of lymphatic fluid a day, and the body doesn't know to reroute that fluid and to move it out of an area that's affected to a healthy area that can take that load. So gravity really does a number during the day and at night on those impaired extremities. And sometimes it's more than an extremity, it's both extremities or the trunk, head and neck, and things like that. So the purpose of that nighttime compression, a clinical purpose, is that it maintains that external compression of those impaired and damaged lymphatic systems, and it keeps that system moving at night. It improves that skin health and texture. So when the patients wake up, they have had a decrease in volume or a decrease in fibrotic tissue instead of an increase. And it improves the fit of that daytime compression and extends the life of those garments, because I try to equate nighttime compression to, like, if you're trying to lose weight and the only thing you have to do is wear this thing at night so that in the morning you wake up and you're just like either a tad skinnier or you didn't gain weight all night. It's kind of the same thing. So if I could magically put on something and wear it at night and know that all my calories throughout the day aren't really going to creep up and catch up to me at night, I would sure do that. And so I feel like that's what compression is. And I kind of tell patients that for nighttime compression is that just think of it as a way to keep that daytime swelling down, because that's when you feel it the most. It's most intense and most uncomfortable during the day. And that nighttime compression helps to fight that. And there's a word for that. We're going to get into that in just a minute also. So we're going to go over 3 ways that night compression improves outcomes, because what are we so worried about in the clinic for documentation to show the need for therapy and to show the need for garments? it's outcomes. We have to meet those outcomes. And also patients won't continue to come and see you. They won't continue to be compliant with their therapy unless they know what their outcomes and their goals are. They know how to get to them as well. So the first way is that it decreases the effects of gravity. I tried to play my John Mayer clip here. It's one of my favorite songs, but he says gravity is working against me. And that's the case for all of us, okay? So gravity is always trying to keep us down. And at night, these effects are lessened, but they're still there. So during the day, we are vertical, we're upright, and gravity is pulling against us. And the only person with lymphedema that daytime vertical gravity helps are patients with head and neck lymphedema. And that's because head and neck lymphedema drains down into the central trunk. And so daytime, their compression needs are lessened, but at night, their compression needs are heightened. So night compression eliminates those effects from horizontal lymphedema, and it helps to improve the health and the function of your patient's impaired lymphatic system. And I thought this was a funny meme. I just made my own out of it. But Mom, why is everything on the floor? Duh, gravity. Sounds like something I would have said as a teenager. So another way that the nighttime compression helps with outcomes is it breaks down fibrotic tissue. So this here is a tribute night, an LNR tribute night compression garment, and it is full leg, and you can see where the channeling has broken down and moved some of that fibrotic tissue and just that lymphatic fluid. Now, this is not permanent. As a therapist, you know that those indentations, they come and they go. If compression is left off, those indentations will fill up and it will be plump and smooth in a very, very short amount of time. And if you continue with bandaging on top of that, if you were to go into multi-layer bandaging, or you were then to go put on your compression garment, your daytime garment, those lines would smooth out and it would just continue to decrease in volume. So the hard orange peel type skin changes are common with lymphedema, especially chronic lymphedema. I see that quite a bit in upper arms, the thighs, and as well as the abdominal region. Generally, patients who have a larger belly that kind of sits in their lap and on top of their thighs, you'll see that it does a V type shape because gravity is pulling it down. And generally it's hard, firm fibrotic tissue there that is from that lymphatic fluid just settling in, and it creates that orange peel texture. So compression garments with LNR, especially the tribute night garments, they're extremely helpful to break down the fibrotic tissue, and it improves that skin health, and it helps to diminish the orange peel texture. So the word I was hinting toward earlier is that it prevents rebound swelling. So rebound swelling, so I'm going to read here from this, is that the purpose of the night garment is to prevent rebound swelling. It maintains volume reduction and addresses soft tissue changes associated with chronic edema. So this is perfect summary of what night compression does and what rebound swelling is. So you've worked all day, your body has created that 3 to 5 liters of lymphatic fluid that naturally occurs on a regular basis. You've worn compression garments, but you've still been very active throughout the day, walking, living your life, up and down, things like that. And so when you go to lay down, the effects of gravity are lessened, but that rebound swelling is still there, because while the effects of gravity are lessened, you still do not have any external compression helping to move that fluid up. So this is kind of where that whole scenario of, if I could just wear like magic pants to sleep and wake up either a pound less or no weight gain at all, I kind of think this is the same scenario. You go to sleep after wearing your compression all day and say, you're 100 pounds. I mean, this is a silly little number, but you're 100 pounds. And so you go to sleep and you don't wear compression, you might wake up 102 pounds. Okay. So it's not a huge deal. But then if you have, so that would be the rebound swelling of 2 pounds. And then if you wear your nighttime compression garment, you started off at 100 pounds, you might wake up at 98 pounds. And so when you wake up at 98 pounds, your daytime garment fits better, you move better throughout the day, you feel better throughout the day, and then you just carry that on consistently. So the next night you go to sleep, maybe you're 99 pounds because you had a busy day. So the swelling in the extremity is equivalent to 99. And these are just silly numbers, but I think you get the point. And then that in the morning, you may not wake up less swollen, but you don't wake up more swollen. You stay and you maintain. And so your garment, again, it fits better instead of having that rebound swelling and waking up in the morning and having a tight fitting garment or a little bit more difficulty getting into the garment. These are some really good references here from the International Lymphedema Framework. This would be a good thing to maybe present in the clinic as well to patients to kind of help them understand why it's so important to have that compliance at night and not just take that break, because it feels like a break, but it does take you back a little bit without being compliant in that nighttime. So a huge difference in day and night compression is how it works. So how does daytime and nighttime compression work? It's working pressure versus resting pressure. And during the day, you need much more working pressure because your body and your muscles are working. As lymphedema therapists, we know that the lymphatic system does not have a muscle pump, a central pump like our cardiovascular system does, but that our lymphatic system functions based on our muscle activity. So we need more resting pressure because our muscles are not active, and we need that slow, steady gradient compression instead of having the increased pressure with muscle contraction and things like that. This is also a good diagram to kind of help demonstrate what the exact difference is, because when you think of working and resting pressure, it's kind of like, are they equal? Are they different? But they're very much different. So this is just a really good example of how daytime and nighttime compression are different. So this patient here imaged is wearing nighttime compression, and it shows that night compression is safe for prolonged inactivity. We would not want to put a patient in a custom traditional daytime compression garment and have them go to sleep in it because of that high working pressure, and there is no work going on, and it would just create a little bit more of a tourniquet effect, and eventually it would cause some pulling distally if maybe the hands or the toes were left open instead of working it up proximally towards the center of the body. So here is a side-by-side of day and night compression. As lymphedema therapists, we know that daytime and nighttime compression are very different. And often you'll find that nighttime compression is pillowy and soft, sometimes comes with Velcro, adjustable tabs. It even sometimes will be neoprene because we'll talk about the Ready Wrap a little bit later, how it's a day and nighttime safe. But your traditional custom and off-the-shelf daytime garments are these sock-looking, very thin, very flat garments that are fitted and created in a way that work gradient compression distal to proximal. And nighttime compression has gradient compression in it as well that works distal to proximal, but the structure and the way that that pressure works is different than daytime. So with L&R, there are a endless variety, honestly, of nighttime compression garments. And I know that in the clinic, I have extremely enjoyed using my L&R garments because my patients have a variety of options. And some of their options, it's like a mix and match. You can kind of wear them together or you can wear them separate. So we're going to jump into those types of garments first. And I'm just pausing here to see if there's any questions that pop up. Lindsay, if you'll be so kind as to let me know. If there's Q&A, I know we're going to have a chat at the end. I just want to make sure that I don't miss anything from anyone who may be wanting to ask a question. All right, so we have our first night compression option with LNR. So our Rosidol line, the LNR, I just love it so much. It's honestly the bandages that I only use. So these have so far been the only bandages that I have kept in my personal stash and that I often recommend to patients to buy because they have a life of like 50 washes and uses. So it's great. In the foam that comes in the Rosidol, I think that one is Rosidol K. No, it's short stretch is Rosidol K. Rosidol Soft, I'm guessing at this point.
Yep.
Thanks. I just went blank. I was like, oh, I don't have a picture. So I know that the Rosidol Soft foam is also washable and you can air dry it. So unlike using cotton, which has a place and you can use the cotton definitely to help buffer and to build out that shape. But the foam is so long lasting. It is just for the price and for the number of uses, I just think it's the best. So that's my personal opinion. Just giving you that professional opinion more than personal. So let's talk about multi-layer short stretch bandaging. It is the primary form of compression during that first phase of complete decongestive therapy. So we know that each phase has its own duration, outcomes, and purpose. Okay, so outcomes and purpose are similar. But let's talk about the initial phase. So it's the decongestive phase. The duration of that can be 2 to 6, maybe even 8 weeks or 16 weeks, depending on how much fibrotic tissue, the staging of the lymphedema, and really what kind of additional issues are being dealt with. You could have wound care, you could have issues with mobility, it could be a home health patient. But either way, multi-layer short stretch bandaging is the foundation and should be the number one thing patients start with for compression therapy. It is my go-to and it's the thing that I do love the most. I'm also checking my time, Lindsay. So we have outcomes that are different. So the purpose of the decongestive phase is to get that volume down as comparable and close to the unaffected limb as possible. So if you can get close to like 3 to 4 centimeters of the other limb, and sometimes even less, down to maybe 1 centimeter, if that's a possibility, you want to get those limbs down as close to the same volume as possible before moving on to the maintenance phase. Maintenance phase is when you are fitted for your compression garment, either custom or off the shelf, and then you would move into maybe nighttime garments that we'll talk about later. But you can also use this multi-layer bandaging at night during your maintenance phase. And I want to hit a high point that I think a lot of us forget, and I am guilty of doing this with patients as well, where it's almost like, congratulations, you've graduated from the decongestive phase. You don't need to bandage anymore. Just wear your garments, your day garment, your night garment, and go about your business. But even in the maintenance phase, even when you have a really good night garment, even when you have really good day garments, there is going to be a time where some of that rebound swelling could still be creeping in. And you just need to get back to the basics and do some short stretch bandaging for 1 day, 2 nights. You never really know. You just do some short stretch bandaging to kind of break off some of that extra fluid and just get that volume and that circumference back to where you want it to be so that it matches the opposite limb. Here's a picture of Nicole. So this is a really good example of short stretch compression bandaging. She has multiple limbs involved. I know that she has custom compression garments and she wears those consistently, but she still prefers to do multi-layer compression bandaging at night because it helps to extremely prevent the rebounding, because you can adjust the foam, you can adjust the build out, and you can also self-adjust your gradient. So bandaging definitely helps to decrease that rebound swelling that can occur over time. And it also is just a good thing to kind of throw back in once a week, once a month, whenever your patients are in that maintenance phase. And it's not just for kids. The highlight on this slide is definitely some of our kiddos from Bryland's Feet Foundation. who have received compression supplies, and their therapists and their parents are learning how to wrap them and to help with their mobility and development of their milestones as well. So these cuties, ah, so sweet. So compression bandages, the multi-layer short stretch bandages, the Rosidol line is completely customizable compression. And you don't think about customizable short stretch bandaging in the same way you think of like a tribute night that's customizable, because you're thinking of zippers and Velcro and half a leg and a full leg and all these different things. But short stretch bandaging is completely customizable. You can have dense or soft foam. You can adjust that gradient yourself. You can create some chip foam. You have inelastic anchoring that's available. Machine washable garments, multi-layer short stretch bandages are all machine washable. You can air dry, and some are even recommended to go into the dryer. And so all of these are customizable. You put the padding where you need it. You can bulk it up medially or laterally or wherever you really need it to help with those trigger points and just those tricky spots. And like I said earlier, it is perfect for pediatric patients. Kiddos move and grow so much that you're frequently either rebuying compression garments if you fitted them in custom, or you're having to rewrap or reapply, because the more they move, the more they decongest, and the more their garments need to be adjusted. So wrapping babies during naps and nighttime is a really great way to get them decongested, and then just keep something on them, bandage or compression garment during the day, and that helps to maintain some of that volume. So the Crecia is a garment that is in this picture. It's the blue chip foam sleeve, and there's a bunch of options, and these are safe for day and for night wear. And so if you're going to wear this garment at night, you don't actually have to apply the short stretch bandaging. I know that when I originally started treating patients, I could think of him right off the top of my head. His name was Mr. Birmingham. He came in and we got him in a Crecia with the glove and the full styloid to axilla, and he saw great results overnight. And then eventually during the day, to make it a bit easier on him, we switched just with Crecia and his short stretch bandage. So this is a study here that was done by Dr. Votter at the Whitlinger Clinic. And you can see here that there were some really specific results. I'm gonna try to read this by making my screen smaller. So there were 29 patients, and 38% of the participants experienced feeling the fit was better using the Crecia. So fit is important. If something doesn't fit, the patients aren't going to wear it. If it's too tight or it's too loose or it's really uncomfortable, patients are not going to stay compliant and wear their garments. And compliance is the only thing that's important when it comes to these patients getting treated, because without their compliance and their full understanding, we don't have anything to work with. So 41% of them saw reduced bandaging time with the Crecia. So they felt that they didn't have to wear it as long in, I'm assuming, in the maintenance and the decongestive phase. And then 34% of participants' fibrotic tissue was further reduced with the Crecia. And that is because the Crecia has the chip foam built into it. And it is essentially all that buffer and all that build out that we would be using on a patient using foam and cotton and anything else we can get our hands on to build it out. This is just a slip-on version of that, but with chip foam, so it helps to break up that tissue. And overall, 43% of participants tolerated 24/7 bandaging protocols better with the Crecia. So compliance was up a lot, and that is ultimately one of the most important things. So here you see that the Crecia plus the Rosidol K is a great fit. When you order the Crecia, if you're recommending this to your patient, be mindful that a Rosidol K garment, a Rosidol K short stretch bandage does not come with it. You can order that separately, but they are a great pair. It's like peanut butter and jelly of the compression world. So short stretch bandages provide that gradient compression over the chip foam, and that is how you get that decrease in volume. but these garments are also really good for upper and lower extremity, and they come with a good warranty. The Crecia has a 6-month warranty. And then like I was talking about earlier, the Rosidol K bandages are washable and reusable up to 50 times. So that is a very long time. And the most important part of talking about the short stretch and multi-layer bandaging is that it is the key to long-term success. It's not over whenever the maintenance phase begins, because this type of bandaging should be reapplied and revisited pretty regularly. Now we're going to talk about the Ready Wrap. This is adjustable and safe for day and night wear. You can see here this man is wearing the lower extremity one. There are so many options. You have toes, foot, ankle, all the way up to the thigh and the hand and the arm. The easiest part about this is that it comes with a 6-month warranty. So they always, back up with their customer service, the fit and the satisfaction of their garments. So you can combine day and nighttime compression with this one garment. So to wear it at night, you just adjust it and make it slightly more loose, but you still have a gradient compression in it. And then when you wake up in the morning, you readjust and you can go about your day. I have often recommended this to individuals who have a difficult time with handling short stretch bandaging rolls, the Rosidol K rolls, who aren't able to either bend over for a long period of time to apply that bandaging, or even if it's someone who lives alone and they have a difficult time bandaging their arm. Because when you self-bandage, there's a point where you're doing a lot of this because you have to get it around your arm and you're doing all this lifting. And it can be done and it's effective. But sometimes for some of our patients, if they're fresh out of breast cancer recovery, or if they're having any other shoulder issues related to fibrotic tissue and radiation treatment, the short stretch is not always the easiest option for them, but these Ready Wraps are very helpful. Sorry, I blanked out for a second. And the cool thing is that they have these accessories that are the extender straps, the exo anklet, and as well as their thigh high liners. These are all really helpful that can go with that garment. Here's some cool points. So I want to point out in this picture, you can read the really specific details that L&R provides, but what I love is that it perfectly does a 50% overlap. And this 50% overlap, you don't have to guess and hope and just say, just remember to keep it 50%, because even whenever we're CLTs and we're learning about the overlap, there's times where we have to practice, right? So we have to expect that our patients and their caregivers or their family members, they're going to have to practice. But this takes the guessing out of it. Perfect 50% overlap because of the way that it's structured and made. And it's Velcroed in very specific parts so that they stay in place where you put them. So as the patient moves and is going throughout their day, it's not slipping a little bit. There's not a little tug here. It's not getting loose here, because there is Velcro everywhere and it reinforces it everywhere. So there was this really cool article published in the Journal of Wound Care, excuse me, and it talks about how the Ready Wrap improved the healing time even when patients didn't wear it perfectly. Okay, so you can see here clearly in this picture, as a therapist, it kind of drives me crazy looking at that figure A, because I see that there's a wrinkle here. This is extremely overlapped by way more than 50%. I know you can see it too. And they have, I don't know what's going on exactly here, but that looks like it's in the wrong spot as well. Okay, so then if you look here, the garment is on appropriately where that it is supposed to be in place, but they still had improvement of their skin, decreased time for healing of that wound, and decreased volume, even when it was worn not in the most perfect way. It's because the Ready Wrap really just takes that guesswork out. And even though they may put that Velcro in the wrong place, it is set to only overlap at 50% by the structure of that garment. So it's extremely helpful. And you don't have to worry about that tourniquet effect, which I often worry about with patients, wondering if they're able to tell when it's causing a tourniquet effect or tell when that fluid is being redistributed distally instead of going proximally. So this is really helpful. I do see that these questions are coming in, and hopefully I've answered that yes, you do decrease the compression, the Velcro at night on the Ready Wrap. And yes, those bandages, short stretch bandages do work the same. Okay, we're gonna move on and I'll answer the other ones that are coming in. So, I mean, this is what I've been just really pumped to talk to you guys about is the Tribute Night Wrap. Sorry, not wrap, the Tribute Night garment. It is 100% personalized and custom to your patient's needs. I wish I had known about this garment sooner, and especially in the new upgrades that they have made with the low profile and the traditional fit or filling of the garment. So let's jump into this because this is really great. And I want to just off the top tell you guys that if you don't know, therapist to therapist, compression garments, even these custom garments, can and are being covered by insurance. So of course, there are some insurances like the Medicare, Medicaid patients, we tend to have a harder time getting those covered. And we are working so diligently with the Lymphedema Treatment Act. If you aren't already, this is a plug. Go and find out about them, support them, because we are working to fill that gap for that insurance coverage, which will only help all of our patients in the future. But private insurances, many private insurances have contracts with these national companies like the Medical Zone and LunaMed, I think SunMed or some other ones. But reach out to a rep or someone with a place like Medical Zone and get your patient some national coverage, or not coverage, but support really through those big DME companies, because they are the ones who are able to get those garments covered in their insurance. I've worked with a local DME company. I have been told so many times, no, 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 it doesn't cover it. But then we've switched to another company, and this one that I've specifically had experience with is Medical Zone, and they are able to use their billing company. They go through insurance, and it is the same process, but the final answer is yes, it's covered. So try it out, look it up. And if you have some questions, actually on the podcast soon, I'm going to have an episode talking about how to get your patients covered, their insurance covered with better documentation. So a lot of it is on us as therapists to have that insurance coverage through our documentation and through these other companies that are able to get that. So Tribute Night, right here, endless options, literally head to toe. You have the mandible option. This one has the eyepiece covers, single arm, single and cap sleeve on the other arm, pants, bodysuit, single leg. We're going to have a special guest in just a second to talk about their personal experience with the Tribute Night. But before, I want to let you know there is a 12-month sure fit guarantee for Tribute Night compression garments. L&R will make sure it fits right, because again, if the patient gets a garment that doesn't fit, they're not going to wear it. And that's the most important thing, is that they wear it. It's easy to maintain. It's machine washable and dryer friendly. And you always know the customer service is like the best at L&R. You always know exactly how to get in touch with them, because they have a warranty card number that comes with this, and there's no guessing. It's like, hey, this is my number, this is my name, boom, they pull it up, and then they can look into it if you're needing to have it refit. And the sure fit guarantee includes if you wear it and then 6 months later you've decongested, you get to have it remade that fits you, and it's within that 12-month period. So just have it remade and your garment is then ready for you in your new size, because it's done its job, and it will help you get that fit, because they know that that long time use is the most important thing. And I have a whole podcast episode with Lindsay talking about this, and we're going to show you how to find that at the end of this. So I was telling you there's a high and a low profile tribute night option. And this is a pediatric early impressions garment in that low profile height. So you can see here, this is Brylan wearing her new garment. It comes down to her MTPs. Yeah, MTPs. I thought I said that wrong. And you can see the indentations after she woke up the next morning. And she's pretty well maintained, so she's not going to have a big drastic impression. But this is really good for her, and it's helping to break up some of that old fibrotic tissue that's been hanging around in there. All right, so we have Cam hiding in here somewhere. Come on, Cam, join me, sir.
All right, can you hear me?
I can hear you.
Can you see me?
No,
I think because you're sharing, you can't see me.
I can.
All right.
So first, thanks for joining us, Cam. We know that you are recovering from your knee surgery, so thanks for being with us. This is your tribute night garment. Can you tell me about your fit? Because you got a cool little get up going on here.
Yes, absolutely. So first off, thanks for the L&R team for having me. A really great product. Obviously, I've been using it personally here. And in this particular garment, first off, I'm a primary lymphedema patient. And most primary lymphedema patients, if it affects one extremity, like in my case, it's mostly my edema presents in my knee and my upper thigh. But there's also some central involvement too in my inguinal nodes and in my kind of genital region at times. So what we have shown here in this picture is a custom-made tribute nighttime garment that I had a local DME. So Betty was just talking a few moments ago about going through DME for insurance coverage. And with my insurance policy, it was covered, fortunately. It's going through that DME. So they did all kind of the heavy work on the documentation from my physician and lymphedema therapist. But essentially they custom made this one for me. So it not only gives me coverage for my entire right leg, but also covers that central region in my abdominal and groin. And I absolutely love it. For those of you who don't know, I live in Houston, Texas, which we're starting to get to the point where it's going to get in those triple digit months where it's really, really hot and humid. And having something to wear in the nighttime, because again, as Betty said, lymphedema and gravity don't take any time off.
Yes!
So yeah, I had to do the John Mayer plug. And that's what I tell my patients too. So I work for Lymphopress. It's a pneumatic compression pump company. And I also encourage a lot of patients to seek their lymphedema therapist, their physician, because one thing that I do every single night when I'm pumping with my Lymphopress pump is I have a foam chip garment like the Tribute Night underneath it, because it has worked wonders on my fibrosis and really makes the pump even that much more comfortable. So yeah, I even see that you have the fly opening for potty breaks, because that's another way you know that the garment's doing its job by moving that lymphatic fluid. And part of the way our body gets rid of that lymph fluid is by way of urination. So there have been many nights where I'm waking up at 2 or 3 in the morning, I'm rushing to the bathroom, and I applaud those at L&R for making it an easy access, if you will, to relieve myself.
All right, great. So I appreciate you going into detail on that. I really was like, how do I address exactly what I'm trying to highlight here? But it's better to hear it from you. So I appreciate that.
My pleasure.
All right, so we're gonna have Cam back in just a minute. I'm gonna hit a few more slides, and Cam, we'll see you in just a second. All right, so the Tribute Wrap is the adjustable off-the-shelf option in the Tribute line. So Tribute night compression garments are 100% customizable, and they are made to order. The Tribute Wrap, which we're talking about right now, is off the shelf, 100% Velcro strap adjustable. And did I mention it's off the shelf? So you can get it in like 3 days instead of waiting for something to be fitted for you. So there are a lot of patients who said, hey, I don't necessarily need a custom garment. and I would like for it to be adjustable. And L&R listened, because that's what they do. They listen to their customers. So in one night's sleep, this is a real patient's experience. This is an upper extremity lymphedema patient who has fibrotic tissue and has a very, very busy day job. She's a restaurant manager at a very busy restaurant in town. And so she is always moving and grooving. She wears compression and a glove, but sometimes she's popping it off. She's, cleaning tables, she's making food, she's helping people in the restaurant. And so she wore this compression garment. This is the Tribute Ready Wrap. This is, the Tribute Wrap. I keep getting my words confused. Sorry. This is the Tribute Wrap, and she has the glove component. And then this is the wrist to axilla. So you see here in her forearm where she is actually, this is one of her trouble spots. She has a lot of fibrotic tissue here. You can see those indentations from the channeling. And even here on her hand, you can see that she's had a lot of palm swelling. And so her indentations are here. And then with one night, this is her results after one night. Imagine going through this. It's going to long-term soften that fibrotic tissue, long-term decrease that fluid, and move it all out of that limb. Here are some specifics. You'll see here that this has the finger loop in the tab. So if you need to hook, so if you're like pulling, you're going to hook and drop, or if you need to get some traction to get that Velcro off, because it's medical grade Velcro and it is strong, it's intended to be that way. This helps you just kind of get it off of there. Cam hit on it a minute ago, but L&R has the Cool Core fabric, and that helps to regulate the body's temperature, and it's chemical free, and it's just cooling instead of what you might think is like a really hot blanket or pillow wrapped around you. This thing is actually pretty comfortable, very comfortable, in fact, and cooling instead of sweaty and kind of sticky to wear it. I do want to mention that there is a sleep sleeve that complimentary is included, and it helps to ensure that your straps don't, get peeled up when you're sleeping at night, or if you're walking, or if you have fur babies that stay with you, your garment is going to stay clean and protected by wearing that sleep sleeve over it. Here are all of your options. Glove, wrist to axilla, MCPs to axilla with thumb loop, below the knee, lower extremity, and thigh high, knee to thigh. This has a 6-month warranty. You don't have the 12-month on this because it's not custom made, but the 6-month warranty is extremely generous, I think, from L&R and Genius, in fact. And it's, again, machine washable and dryer friendly. It actually responds to that dryer and kind of does a little recoil, and it's kind of tighter and more snug. Like if you washed your blue jeans and you've worn them a few times and you wash them and dry them, they kind of fit a little bit tighter and a little bit better. Similar thing going on here. So we're going to bring Cam back on because we want to talk about how the Tribute Wrap can fill this gap for patients that we often leave out. Speaking as a therapist, I know that a lot of patients have been recommended to have knee replacements, hip replacements, other surgeries and things like that. But they say, I have lower extremity lymphedema. If you cut me, I can't wear compression, and I can't go 6, 8, 12 weeks without compression, or it's going to totally upend this knee surgery. So Cam, here in our left photo of you, this is you after your LVA surgery. And that's actually the same little stint as when you were wearing your Tribute night garment. So I know that you were able to wear your Tribute night after your LVA because there weren't staples and big deep stitches and things like that. But here with your current setup, you've got staples and incision, and sutures. So how do we think the Tribute Wrap is going to do when we get that baby in your hands?
Yeah, so and that was a challenge I faced even with my LVA surgery there on the left-hand side. So for those of you who aren't familiar, that just stands for lymphovenous anastomosis. That's one of the lymphedema surgical options. It's a very minimally invasive surgery. And as you can see, the edema in my right leg is pretty much gone. That's day 2 post-op. But even with a surgery that delicate, with having small incisions and small stitches, it made it very difficult for me to put on my typical flat knit garments during the day. So I needed some other modality, some other compression modality, like a wrap, like the tribute wrap, that could go over it without disrupting the wound site. So here on the right-hand side, where you see my most recent surgery, it's part 1 of a total knee replacement, as Betty just said, yeah, there's a lot more involvement there. The incision's much larger. The surgeon specifically didn't do it so tight because there's actually some antibiotic beads in there that kind of seep out and leak. So having something to go over the incision while still providing that effective compression is something I'm really looking forward to. And I think a lot of patients who are going to be undergoing any type of orthopedic surgery, or any surgery for that matter, where you're going to have a wound site like this, where you need compression to help the healing expedite, but you don't want to irritate or agitate the wound site by pulling a garment up and over the extremity, like you can if you don't have something like the tribute wrap.
Right. And bandaging even could irritate and cover the incision, and it's going to be better to be able to have that Velcro strap so you can go back and look at the incision frequently and just kind of check and assess it to know that it's, you know, healing and you're not disrupting it or anything like that.
And that's great too, Betty, because as you can see in that picture, in the upper right quadrant of that knee replacement surgery, it looks kind of purple. That was actually a pressure ulcer that one of the nurses inadvertently caused post-op because she had the bandaging way too tight. And I don't think she understood post-op protocol for a lymphedema patient is different than a standard patient who doesn't have impaired lymphatics. So something like the tribute wrap would have been very advantageous for me immediately post-op. And with me having an upcoming surgery at the end of May, I'm looking forward to putting that application directly on me.
Awesome. Well, I look forward to following up with you because I do want to, as a therapist and even as a friend, keep up with your journey and just see the outcomes you have, because I know that the tribute wrap will apply that compression that you need, but that, you know, mixing it with your pump protocol and also just your upper thigh portion that's going to come with that tribute wrap. I'm going to follow up with you, and hopefully we can share your story in a little bit too, because you're not done on this surgical journey. But we wish you well and good luck, and we're all rooting for you. So we can't wait to see how the tribute wrap works for you in a couple more weeks. I think Cam may be frozen, so we'll just keep his face on there for a little bit. So what I'm going to do now is I want to introduce you guys to my friend Kelly Bell with Veterans Fighting Lymphedema. He is the veteran fighting lymphedema. And I could tell you his story, but he can tell it better. So I'm going to jump in here and play our conversation. I hope you enjoy it. For participating in the webinar today, you may notice I'm not wearing these same clothes right now. I recorded this call with Kelly ahead of time, and I just want to introduce him to you because he has an amazing story. And after talking to him some more, L&R and Tribute Night has been in his toolbox for many, many years. So this is Kelly Bell, the veteran fighting lymphedema. Kelly, welcome to the webinar. Thanks for joining us.
Hey, Betty.
Hey, so you look a little bit different than usually when I see you. I noticed that you are wearing your L&R garment. Can you tell us what you're wearing today?
It's the L&R, I think it's called the mandible garment.
Okay.
I've had one since 2011, and I love it. I mean, it really doesn't help with the sexy bedtime talk, but let me tell you something. This has really kept the fluid off my head, lymphedema fluid off my head.
So I do want to get a little more detail on your lymphedema journey. And I do know that your lymphedema journey is very detailed, and we cannot confine it in probably under an hour or two, to be really honest. So can you just tell us, where is your lymphedema affecting you? Where does your lymphedema present on your body?
Head to toe.
Head to toe.
Yeah.
Okay. And the tribute, the the neck garment that you were just wearing, that one has helped with around the neck and the face. Is that right?
Yes. When it first presented in my head, it started on the right side, and then it just slowly moved around where I had this like huge pumpkin, and it's helped keep it down.
And do you wear any other garments? Because I know we've talked about you've, I think, worn like lower and upper extremity. Are you wearing any other ones?
At one time I wore garments all over because of all the things I've been able to do. I've gotten it like back out of my arms and my legs, so I don't wear those anymore. And so really where I keep my lymphedema is where in my trunk where I have the damage, and my head, believe it or not. And it's like, this is some fibrotic tissue. I don't know if you can tell on the camera, but it's really on one side. It's on the right side, like of my head. It's like different from here, like my pinch. I mean, it's much thicker and it's hard.
So I would actually like to share the story that we talked about earlier, that your garment was on backwards.
Wrong.
Maybe. Okay, wrong. I was trying to be nice.
Wrong. We'll just say wrong, just to be clear. Wrong.
The garment was being wrong for was worn wrong for how many years?
10.
And you've had it on correct for days?
3 days.
And what have you noticed so far?
Well, I would tell you this. Let's just say I was doing my own little study. Not really, but what I'm going to prove to you is like I had it on wrong, and I had the straps going down here. And it happened to be gapped right where this fibrotic tissue is. And so I was talking to Eleanor last week, and we figured out I had it on wrong. We got it corrected. Within 3 days, this is starting to become softer, and it's shrinking. 3 days. And this is not new fibrotic tissue when I started wearing these things. So I probably wouldn't even have this issue if I wouldn't. But so in 3 days, this is a 10-year-old fibrotic buildup, and it's shrinking and going down.
So I'm going to follow up on that probably a little bit later, because I do want to see how well that mandible piece does to help soften that fibrotic tissue and get that hard drainage out of there. I know you have a lot of tools in your toolbox. I know that you are a huge fan of the pump system from LymphoPress, and I know that you wear your compression religiously and you measure quite a bit. What about the LNR stuff helped you get to where you are today? Because I know that that's been a big part of your toolbox with your compression.
I had the arms, and they were phenomenal. Especially, you're going to hear this a lot when people start talking about pain. But I used to use it a lot to get rid of the pain in my arms, because all the nerve pain from the swelling in my arms, it was pretty bad. And when I slide that thing on, it hurt for a little bit. Within 30 minutes, the pain would be gone. And you're talking to a guy who at one time was they were giving me 3 different narcotics to try to deal with it. And so, I mean, 3 narcotics, 30 minutes in a compression garment. Of course, I just keep it on. And it helped quite a bit, like with pain.
That's good. That's good. So we're going to be seeing you later in a truncal suit. I know that that's one of the garments that is featured in the webinar today that people will probably have a lot of questions on. But the truncal garment that we have coming to you for us to do a little follow-up conversation with, what are the problem zones that it's going to be helping you with? And how do you see that fitting in and resolving some of those issues for you? And if not resolve, I just mean like improve them.
Well, I mean, multiple ways when you think about it. Well, I think we talked about this before too. When I wear regular compression, because all my thoracic stuff, my central lymphatics, not the exterior, are damaged, right? So when you push on me, you're pushing all the fluid where there's damage. And the problem is it can't handle all that. It's not completely blocked. This is all done by imaging. There's no guessing with me. So we know there's like a significant blockage there. And so because the LNR does not squeeze like regular compression, it works like slowly. I think it's going to work with my modality better, because it's going to mainly work at night when I'm not creating more lymph. And so since I don't get to wear compression during the day, because putting that on at night, and I'm actually able to keep up with it, having something actually working at night is actually going to put me ahead of the game every day, every night. And then also, like at the lower part of my abdomen, between my navel and my belly button, just like I have fibrotic tissue here, that's all hard fibrotic tissue, and it's been broken up by the pump a little bit. But I think having that nighttime compression is gonna, I guarantee you, in a month you'll see a huge difference in me in those areas, because those are, no matter how much fluid I've been able to keep off my arms and legs now, my trunk, of course, that's where all the stuff is, has always been my struggle.
Yeah.
And so, because having that garment is going to change everything.
Well, I'm excited to follow your journey because I want to see, as a friend of yours, how this improves your life and just quality of life and comfort. And as a clinician, I have had patients who also had that hard fibrotic tissue in their belly, where, you know, it's kind of that orange peel texture where it's like really kind of rough and not, you know, dense on the outside. And so I'm looking forward to having some clinical information on how well that the truncal stuff works, because usually in the past, I've always just thought, you know, like they can wear an abdominal binder or something like that. All right, everybody. So I went ahead and cut that just a little bit short. Kelly and I talk about wearing an abdominal binder as some of the, you know, solutions that us as clinicians have for our patients. But Kelly actually had some poor lab results after wearing his compression binder. And so we are looking forward to having a follow-up conversation with him soon, whenever he is able to wear his Tribute Night bodysuit that he has coming into him. And so just like him and Cam, we're going to do a little follow-up with them. And at this point in our presentation, we're done with the presentation portion, but we're actually going to just field some questions.
All right, so I'm going to go to the list over here to see what questions have come in. In regards to short stretch bandaging, does it matter how tight the bandages are?
Yes. So I always tell patients and therapists and family members and anyone who will be using these short stretch bandages, even applying them or being the person that's applied to, is that you never want to pull 100% whenever you're wrapping that short stretch bandage. Because as you layer it, and that's the key word, multi-layer, as you layer that compression up the limb, the pressure is increased. So you may think, okay, I need to get this baby wrapped as tight as I possibly can on the first layer. But then you're going to do the second and third and maybe even the fourth, depending on how many you need, just as tight. And you're going to do too much compression and it won't be gradient. It will end up pushing distally in the limb. So yes, the pressure does matter on how much pull is on the short stretch. And I always tell, and there is probably a legitimate number that I should look up and tell you. But what I tell patients is I just pull enough to get the tension, the slack pulled out. So I know that the bandage is going to lay flat, but you never pull so much that you're, you know, constantly pulling and adding pressure, because the layers do that, and it'll build pressure as you add layers.
Thanks, Betty. Next question is, do you ever use ready wrap garments instead of short stretch bandaging? And is multi-layer bandaging superior?
In my professional opinion, and through the way I was taught, I would say that short stretch bandaging is the gold standard for compression bandaging, especially if we're talking in the initial decongestive phase of therapy. There are situations where an alternative is needed, and that's what Velcro garments are termed, alternative compression garments. If you're in a situation, and I have been in them many times, as a novice CLT and someone who really likes to follow rules and guidelines, I had a really hard time with adjusting my standards to include alternative garments first. But there are cases and scenarios where something like the Ready Wrap or the Ready Wrap really is preferred or needed instead of a short stretch bandage for the patient. It could be age, it could be that they live alone, it could be mobility. There's a whole number of things, even immobility. You know, some of these things play factors, and you just have to take into account the full patient. You can't just look at what's in front of you and say, I'm going to make you fit this textbook mold and protocol. You have to go and meet the patient where they're at, or they're never going to be compliant, and you're just going to waste their time, their money, and your time on giving them short stretch bandages that they can't and will not use.
Thanks, Betty. So it looks like we've got 2 more questions here. So Sarah has wrote in, did you say the veteran gentleman could not wear abdominal compression during the day and he only uses the tribute truncal garment at night? And will he try ABD binder over the tribute, or did this cause problems too? Just wanted to clarify.
Okay, so I hopefully can find that question on here so I can be sure to hit all the points there. What I will say is that Kelly, originally when he was in treatment, he wore a binder, and that caused him to have poor, I think it was liver and kidney panels. He kind of took it upon himself to be tested and have his blood work done to kind of see, because his body was reacting. He has a very interesting and very specific story of his experience, which I encourage you to hear whenever he gets his website up and running. But he will not be wearing compression over his tribute night, because the tribute night comes with that built-in compression. And so he basically is wearing, and I'm going to go to my screen here and I'll show you above in the presentation the suit type that he will be wearing. So the suit type that he's going to have is like the thing that like high school wrestlers wear. His will look something along the lines of this. So it gets the full abdominal portion. And he won't be wearing compression over it because, like I said, the tribute night garment has compression built into it. But he originally tried the binder years and years ago. And he can wear compression during the day, but he just mostly wears it at night because he has central lymphedema, and he tends to have more swelling at night when he's laying horizontally and not upright vertically.
Thanks, Betty. So the next question is, I see lymphedema patients with clients with very involved venous problems in the foot and ankle. What are your feelings about using a Ready Wrap type leg garment? And do you get concerned about distal HTN?
So I generally do have concerns, and that is one reason why I like the Ready Wrap garment, is because you're able to more quickly readjust and reapply the bandage so that family members and the patient, if possible, can frequently look and check the circulation, the way the skin looks, and how the fit of the garment is. So I do highly recommend wearing the Ready Wrap, or even, making that a suggestion over the bandaging at that point. And by over, I mean in place of the bandaging, the short stretch bandaging, because you can more easily look at it, adjust it where needed, and not have to take off the whole multi-layer system and reapply the multi-layer system again after you've rewrapped it all. So while the short stretch bandaging system is the gold standard for treatment, it isn't for everyone, and we have to be able to meet our patients where they're at.
Well, that was the last question. Thank you so much, Betty. We really loved having you here. At the end, we do have just a quick slide to show you. We did do a podcast with Lymphedema Podcast. So feel free to share it with your patients. We know that this was really geared towards clinicians, fitters, but wanted you to know that there are resources available to your patients talking about how L&R contributes to patients' nighttime success. So great time for the patient to be able to join, learn in a lot of the things that we talked about today. Thank you so much, Betty. We really appreciate you doing this presentation for us, and we will have this recorded so that people can go back and listen to it and refresh some of the things that we talked about today.
Thank you for having me.
Any parting words, Betty?
So many words, actually. One, I mean, I hope that you go and listen to Lymphedema podcast and share it with your patients. And that is not at all from like a self-promoting place, but it's more from I just want everyone to have as much information and as many tools in their toolbox as possible. And we're on about episode 70-ish. So there's 70 episodes out there of different lymphedema related topics. Some of them include experts, much like Lindsay on there talking about the LNR garments. We talk about wound care. We talk about intimacy. We talk about pediatrics and like Camp Watch Me and stuff. So literally, if it's about lymphedema, we've talked about it. And I just want anyone to know that no topic is off subject. If you have a question or a suggestion, let me know, because if I don't know the answer, I'm going to go find someone who does, because that's what I wanted as an early clinician, was to find people with the answers and to share that information. As far as the lymphedema treatment goes, I just want to say thank you to all the lymphedema therapists who are out there. You don't have to be doing this, but you are, and you are your patient's best chance at success and living that happy and healthy life, instead of feeling just isolated and alone and just stuck with lymphedema. So you're here to help them get unstuck. And so kudos to you for putting in all the hard work, because you guys, you're really doing all the hard work out there. And I just appreciate all the CLTs so much.
Thank you, Betty, and thank you to everyone attending. Have a wonderful rest of your day.